Hi, everyone, and welcome back to the next episode of TILLY, the interactive lupus link for you. I'm your host, Marissa. A lot of you might know me as Lupus Chick. TILLY is brought to you by the Lupus Foundation of New England. It is a weekly episodic series featuring all different types of topics that have to do with lupus patients. Today's particular episode is brought to you by Aurinia, and we want to thank them for being our sponsor. We have a very special guest for you today. Some of you may already know him, and you most likely have read his book and have it on your bookshelves. Dr. Thomas, he is a rheumatologist and teaches at the Walter Reed National Military Medical Center. In addition, he is a fellow of the American College of Rheumatology and a fellow of the American College of Physicians. In addition to that, he is the author of the Lupus Encyclopedia, a comprehensive guide for patients and families. And today he is going to share an incredible presentation about lupus nephritis. You will be learning about symptoms, what physicians that you would see with lupus nephritis, medications, and more. So we are really excited to jump into this presentation and to introduce Dr. Thomas to you.
1 out of every 2 lupus patients will unfortunately develop something called lupus nephritis at some point during their lives. Nephritis means inflammation of the kidneys, and that's where lupus will actually attack the kidneys and cause problems. Since it's such a common problem, it is essential that everyone with systemic lupus know how to identify lupus nephritis early and help us as the rheumatologist treat you better. Hi, my name is Don Thomas, and I'm a rheumatologist who specializes in treating patients who have lupus. And over my career of 30 years, I've learned that those patients who learn as much as they can about lupus, they do best in the long run as far as how they do. And so I'm really happy that you're watching today's program so that you can learn about lupus nephritis. So let's talk about lupus nephritis. Lupus, of course, is an autoimmune disease. It's a problem where the immune system is overactive and attacking the body itself. It can attack virtually any part of the body, especially the joints where it can cause arthritis, rashes such as discoid lupus, even hair loss. It can attack the lining of the lungs and heart, causing something called pleurisy. But unfortunately, 50% of patients with systemic lupus, it will attack the kidneys, or what we call lupus nephritis. This picture here is someone who actually has lupus nephritis, and this reminds me of certain groups who are more prone to developing it. Although all patients with systemic lupus are prone to getting lupus nephritis, some ethnicities, such as African Americans, do develop more often than other ethnicities, such as Caucasians. Lupus nephritis is a common complication of systemic lupus, and what happens with this is that lupus sees the kidney and thinks that it does not belong there, thinks that it's an actual foreign body inside of our own bodies. And so the immune system, which are the white blood cells, attack the kidneys and cause inflammation. And that's when we want to really catch it, is in the inflammatory stage of the disease, because that's when we can reverse it and potentially get it into remission. However, if we see a patient who already is has had it for a while, unfortunately it can leave permanent damage. And when this permanent damage occurs, the kidneys, they lose those important filtering devices in the kidneys called the glomeruli, which are essential in taking toxins out of the blood so that we can urinate them out into the urine. Lupus nephritis is not uncommon. It does affect about 100,000 people in the United States. 1 out of every 3 systemic lupus patients will actually have lupus nephritis when they're first diagnosed. However, it can happen at any time during the course of systemic lupus, although it is more common during the first 5 years. As I mentioned before, some ethnicities are more prone to getting it, most likely because of the genetics in those ethnicities. For example, lupus nephritis is 4 times more common in people in America who are of African origin, also those who have Asian ancestry as well. And it's twice as common in our Hispanics and people who are of Native American descent. So next, let's talk about the symptoms and signs of lupus nephritis. So what is the most common symptom of lupus nephritis? It's actually nothing. Lupus nephritis in the early stages, people feel perfectly normal unless there's something else going on, such as lupus arthritis. And that's why it's essential that we, as your rheumatologist, see you regularly and get a urine sample from you regularly so that we can identify it during this early time period when you don't feel anything wrong and it's at its best chances of going into remission. However, if we catch it late, one thing that happens in almost everyone is that there's an excessive amount of protein in the urine, and that typically gets worse as the damage to the kidneys get worse. And this leakage of protein is one of the biggest causes of the symptoms of lupus nephritis. What happens with this protein in the urea, which we call proteinuria, a type of protein called albumin is leaked out into the urine. And albumin is a very important protein that floats around inside of our bloodstream. And the albumin actually keeps fluid inside of the blood vessels. But when the albumin level goes low because of lupus nephritis and spilling this protein, the fluid inside of our blood vessels starts to leak out into the soft tissues. Gravity pulls it down, and then the person will get something called edema, edema, which is swelling around the ankles and the feet. And this typically gets worse towards the end of the day. When the person first gets up, oftentimes their ankles can look perfectly normal, but then the more they sit and stand throughout the day, the swelling gets worse and worse over time throughout the day. This also tends to cause weight gain because of all this fluid retention. And then it also causes increased urination at night in some people. And that also has to do with gravity, by the way. So when the person's standing all day long, the fluid builds up in the feet and ankles. They lay down at night and sleep. The fluid is distributed throughout the entire body. But then the kidneys, they think that there's too much fluid in the body because of that, which there is. And so that's when the kidneys start to secrete more urine, and then the person has to get up in the middle of the night to go to the restroom. And then this protein in the urine can also cause a foamy, bubbly, or frothy urine as well. So what are some of the complications related to lupus nephritis? One is that the blood pressure can become high. The kidneys are actually very important for secreting certain chemicals that are really important for how our blood vessels constrict and relax in order to keep our blood pressure normal. And when there's damage going on, though, these chemicals are interrupted as far as the balance, and people can end up getting high blood pressure or hypertension. This hypertension can actually end up causing more kidney damage. The kidney damage can make the blood pressure higher. It just becomes a vicious circle, unfortunately, in some people. And then there's also chronic kidney disease. When there is permanent damage in the kidneys, we call it chronic kidney disease. In the early stages, we just see an excessive amount of protein in the urine that's just constantly there. But with continued and worsening kidney damage, we can actually see decreased kidney function. And then people with lupus nephritis, unfortunately, are at high risk of cardiovascular complications. Cardio means heart. Vascular refers to the blood vessels. So this refers to a group of disorders. Heart attacks is one thing that can happen. A heart attack occurs when the blood vessels of the heart have decreased blood flow and therefore decreased oxygen to a part of the muscle of the heart. And then when the muscle permanently dies, we call that a heart attack. If the same phenomenon happens in the brain, where the blood vessels of the brain are involved, the person gets a stroke. It's like having a heart attack of the brain. But people can also have hardening of the arteries. For example, if hardening of the arteries occurs in the arteries of the legs, the muscles get less blood supply as the person walks and stands, and they can get cramping of the muscles in their feet and legs because of that. And then blood clots can also occur, especially in the legs and also in the lungs. And then, of course, the worst thing that can happen in the long run is that when enough kidney is permanently damaged, the person can go into what we call end-stage renal disease or complete kidney failure. This person needs to go on dialysis, and our lupus patients almost always need to get a kidney transplantation when this happens. And this is what we absolutely want to avoid. So what is the road to diagnosis like for the person with lupus nephritis? There's two different main specialists who deal with lupus nephritis. And of course, the rheumatologist is one of them. Rheumatologists like myself, we come from a program where we have a very good training program that specializes in lupus nephritis. So some rheumatologists are actually comfortable enough taking care of their own lupus nephritis patients. However, many rheumatologists don't have that luxury, and so they do have a partnership with a kidney specialist called a nephrologist, and they work together. The rheumatologist is really important for the lupus side of things, while the nephrologist or the kidney specialist is in charge of the kidney problem. And working together, they can take excellent care of most lupus nephritis patients. Unfortunately, there's a huge shortage of rheumatologists. In fact, by the year 2030, there may be half the number of rheumatologists as we have now. And many areas of the country and parts of the world have no rheumatologists. So in some areas, the nephrologist or the kidney specialist may be the only person that many lupus nephritis patients may see because of these problems. So how do we diagnose lupus nephritis? The most important initial thing is that cup of urine that we ask you to give at every single visit. This is why we ask you to come in every 3 months to see us. Just last year, the European Union League Against Rheumatism came out with new guidelines on identifying and treating lupus nephritis, and they recommended that we should be getting a urine sample from all of our patients on a regular basis. And what we're looking for is to see if there's an excessive amount of protein in the urine. And we want to do this when you're feeling perfectly normal. So when you come into my office and tell me you feel normal, that's wonderful. That's what I like to hear. But I still want to get that urine sample, because if you have lupus nephritis, I can catch it at the very earliest stages when it's potentially reversible, and I can even get it into remission. Blood tests are essential because that helps us look at the electrolytes such as calcium and potassium levels. And we can also estimate the kidney function, or how good the filters of the kidney are actually filtering out the blood through the blood tests. And then lastly, the kidney biopsy is essential. When you hear your rheumatologist or your nephrologist recommend that you get a kidney biopsy, it's for very good reasons. And I'd like to cover those on the next slide. When we do a kidney biopsy, we can have 6 different potential results if the person has lupus nephritis, and they're as outlined on this slide. On the very left side of the slide, it has something called class 1 lupus nephritis. All the way on the other side of the slide is lupus nephritis class 6. The most important ones are classes 3 through 5 that you see in the middle of the slide. What you're hoping for, if you do have protein in your urine and you're asked to get a kidney biopsy, are the 2 on the left side of the screen, classes 1 and 2, because they don't need any treatment whatsoever. Just using your hydroxychloroquine or your Plaquenil may be enough to treat those particular problems. If you have class 6, unfortunately, that's the worst type. That means you have permanent damage of the entire kidney or almost all the kidney. And unfortunately, patients with class 6 usually require dialysis and renal transplantation or kidney transplantation as soon as possible. Classes 3 through 5, these are by far the most common results of the kidney biopsy. They're all 3 treated fairly similarly. We use high doses of steroids, we use hydroxychloroquine or Plaquenil, and then it requires us to use immunosuppressants to calm down the immune system of lupus and keep it from attacking the kidneys. There are some subtle important differences between classes 3, 4, and 5, but those are more important for the rheumatologist and the nephrologist to worry about. As far as you're concerned, they require very similar treatments. Now, so one reason for the biopsy, by the way, is that we can tell whether you need no treatment, like classes 1 or 2, or whether you do need strong medications like classes 3 through 5. But also other things can be shown as well. Sometimes there's something going in the kidneys that isn't even related to lupus whatsoever. It might be high blood pressure damage. It might be diabetes causing kidney problems, or it could be hardening of the arteries causing protein in the urine. Or there's also another type of lupus problem called lupus podocytopathy. And if we see that on the kidney biopsy, it's very easy to treat with some steroids and almost always goes into remission. And how do we treat or manage lupus nephritis? It is a complicated issue. It takes a lot of different things to treat our patients, and it's essential that we get your help during this process. It oftentimes takes working with more than one healthcare provider, and we'll talk about that on the next slide. It's really important that you learn as much as you can about lupus nephritis, and by you simply watching this video, you are already showing that you're interested in doing that. And at the end of the talk, I'm going to tell you about a really nice group or organization that you can join where you can even learn more about lupus nephritis. Diet and exercise are essential. Remember, I mentioned that cardiovascular disease is so common in our patients with lupus nephritis. Exercising regularly and eating a good diet is two of the best things you could do to prevent those from happening. And sorry, that's my dog in the background you hear. And then healthy living, of course, incorporating other things such as getting a good night's sleep, learning how to decrease stress, as well as other really important things in your life are important as well. So who are the members of your healthcare team that might be involved? As already mentioned, the rheumatologist and nephrologist are very important. Your primary care provider, I rely upon my patients' primary care providers to especially help in preventing those heart attacks and strokes. I want them to help me manage that blood pressure and the high cholesterol and the diabetes that may happen. Some people, unfortunately, will develop severe depression or other mood disorders and may require a psychologist to help them out. Sometimes the diet can be quite complicated and complex, and in that case, a dietitian or a nutritionist may be involved as well. So what are some tips for working with your healthcare team and your healthcare provider? Well, there are some things that you can do to really make things go a lot better for you. For example, keeping track of your office visits are incredibly important. Make sure to write down any symptoms that you've had over time. Remember, I'm sure all of you have had this happen to you at some point or other. You're in the office with your doctor and you had this really important question to ask and you just can't think of it. It's like right at the top of your mind and you just can't remember it. And then you remember on the way home or when you get home. Whenever you have a question to ask, write it down immediately. And then when you go in to see your doctor, have a list of those questions ready. I recommend having just a few questions written down at a time. It's really important to remember that your doctor is also human and we can only handle so much at a time. So maybe about 3 or 4 questions at the maximum is probably the most that they can handle. In addition, as soon as you start to see your doctor in the examination room, let them know you have some questions to ask that you would like to have addressed before they leave. The last thing you want to happen is as your doctor's going out the door and opening up the door is then to say, oh, wait, I got some questions for you. The problem with that is that the doctor may be running behind and may not have planned to have that extra time to answer questions. But if you prepare for it ahead of time by letting them know right at the start of the visit, that can make a world of difference because your doctor does want to answer your questions and he wants to make sure that you have time during your visit for he or she to do that. Also, it's very helpful if you organize your own recent results and your blood work and your lab tests. I recommend that every single patient with lupus keep a copy of your own medical records at home. And this can be life-saving and it's essential. And the reason for that is number one, you never know if you're going to need to move in the future. Number two, you don't know if you might have to change insurance companies and have to switch from one rheumatologist to another. And if you have all your medical records at home, such as your kidney biopsy result, your old lab results, your rheumatologist and nephrologist actual office visits, that can make a world of difference. It's best to do it one visit at a time, by the way. I recommend that once after you see your doctor and you go up to the front desk to check out, just ask the front desk, can I please have a copy of my last note and my last labs? And if you do that, I guarantee you they're going to give you a copy of it. If you ask for all your records at one time, going back a couple of years, they'll probably charge you for the records. And so this is a good word of advice as far as asking for your records a little bit at a time at each visit. In addition, bring a list of your medicines to every single visit. This is one of the biggest things that I talk to my patients about every day. There's a secret that most of you might not realize. Most of the time, your doctor's medication list is incorrect, or you're taking your medications incorrectly. And there's a lot of potential reasons for this. One is because of electronic health records. It sounds like having everything in the computer would be more accurate, but it's really not, because so many things can go wrong. Whenever we put the medicines into the computer, we have to put the name of the medicine, the dosage, how often you're taking it, and how many at a time you're taking. And then we have to, if we change one medicine to another, we have to physically go in there and remove that other medication. In addition, sometimes just any little difficulty with that part of things can have the medication incorrectly. Another thing that can happen, for example, with my electronic health records, is that when a medication gets down to 0 refills, oftentimes the computer will automatically drop that medicine down from the active list into the inactive list. And then all at once, it looks like you're not on that medicine anymore to treat your lupus or any other of your other conditions. And that doesn't happen infrequently. But if you bring in your medication list, my medical assistant or nurse can figure that out right away and say, oh, we need to bring that medication back up. Also, we need to know what other doctors are giving you. And the only way we know is if you write down exactly what you're taking as well. And so what you want to do is have a medication list where you have the name of the medicine, the milligrams, how many you take at a time, and how often that you take it as well. And you want to put down exactly what you're taking, not just what your doctor thinks you're taking. And I like to give you a very good example. Recently, during this past year, I have a patient with really severe lupus. And the last couple of times that I checked her hydroxychloroquine or Plaquenil drug level, it was 0, which tells me she was not taking her hydroxychloroquine at all. Yet she would come in and tell us she was taking her medicines and she had it on the medication list. So I was thinking that she was taking all of her medicines and hydroxychloroquine, and she was doing horrible with her lupus. But in reality, what had happened is that she wasn't taking any medicines because she couldn't afford them. And so if she could have brought in a medicine list that said she wasn't taking anything, we could have figured this out right away. And then I could have worked with her on figuring out how to get around this problem, because we could have gotten her some patient assistance with her medications, and we could have got her back on her medications right away. So this is a very important issue, is make sure you bring in that list of medications at every single doctor's visit. Also, it can be very helpful to take a friend or family member. I love it when someone has a friend or family member along. Number one, I know that the patient's going to remember things a lot better. Having 2 sets of ears is going to remember what I say a lot better than just one person. Also, that family member or friend may help remind you to tell me something that you might have forgotten, or ask me a question that you might have forgotten as well. Another helpful thing, by the way, is that lupus, as you all know, is an invisible disease. You look perfectly fine to most people. Most lupus patients do, especially lupus nephritis. You can look perfectly normal and yet still be very, very sick on the inside. And because of this, many lupus patients, unfortunately, do have bias and prejudice against them because their family or their co-workers or their friends may not believe that they have something significant going on with them. But if you bring in your spouse or your sister or your mother or your best friend, and they hear what the doctor is actually telling you, boy, that can make a huge difference. And I've seen relationships become so much better because of that. So I'd encourage you to do that. And then, of course, ask any questions that you may have, just as I already recommended. Well, this is December of 2020, and COVID-19, the pandemic, has been in full force for the last 9 months. Because of that, many of us are doing what we call telemedicine. We're seeing our patients through the internet or even on smartphones using FaceTime and other types of platforms. And there is some good advice on things that you can do to make your telemedicine visit go a lot better. Again, make sure to have those questions ready and let us know right at the beginning of the visit that you have them. Make sure that you have a reliable internet connection. The best connection, by the way, is having what's called having your computer hardwired. And what that means is just get an Ethernet cable. An Ethernet cable connects directly from your computer to your internet modem. And the nice thing about that is that you're going to always have the internet unless the internet itself goes down or your cable goes down or something happens or the weather is so bad that poles are knocked down outside your house. But if you have Wi-Fi, it's important to make sure you have a strong Wi-Fi connection. And if you don't, make sure to get some help from friends or family who are tech savvy to help you do that. It's the second best thing to having your computer hardwired. And then also there's oftentimes something called a chat feature. And I love that with our platform that we use in our office. When I'm seeing my patient over the internet on the computer, if I want to type them something, I can type them something and vice versa, back and forth. I like to use it for a couple of reasons. Number one, if I have a medical term that I want to spell out for them so that they can look it up on the internet, I'll type it out so that they can see exactly what I'm talking about. Or on your end of things, if I say something that you don't understand, it's really important. You say, Dr. Thomas, what did you mean by that? Could you maybe type it out and make it a little bit easier? And it's a great way to use that chat feature. Or sometimes I want my patients to go to a certain internet site or to Google something, and I can type it in the chat feature as well. So make sure you utilize it if it's part of your platform. And then also make sure to wear the right clothing. A good thing about the internet is that you don't, and telemedicine, is you don't have to dress nice or fancy to see your doctor. In fact, we would rather you wear comfortable clothing. And the reason for that is just in case we want to examine you. For example, remember I said that you could have edema or swelling around the ankles and the feet. But what if you have on boots and socks and stockings and your long underwear? It's going to take you forever to take those off to show me your foot and ankle. I'd much prefer you be wearing a t-shirt and some shorts and nothing else, or maybe just some socks to walk around in. And if you feel uncomfortable doing that, by the way, as soon as you start your visit with your doctor, just say, I'm wearing a t-shirt and shorts just in case you want to examine any part of my body over the video. And then in addition, it's incredibly helpful if you can check your vital signs. I recommend that all lupus patients have a blood pressure machine at home. So if you can afford it, please get a blood pressure machine at home, and that can also check your heart rate as well, and also a thermometer, of course. The reason you want to do this is that it's very helpful if you check your blood pressure and heart rate do it a couple of times for a few days before your visit, and then have that list of blood pressures and heart rates for us. Oftentimes, the blood pressure at home can be more helpful and more reliable than what we would get in the office. And so if you do that, that's a great help. So what else can you do besides the medications? And by the way, the medicines that we use to treat lupus nephritis, I already mentioned them earlier in the talk, but remember, lupus is a disease where your own immune system is overactive and it's attacking your own body. It's attacking the kidneys. There's only one way to treat it, and that's to calm down the immune system, to keep it from attacking your body. So we have to use medicines called immunosuppressants. These immunosuppressants include steroids. The reason we have to use steroids most of the time is it's the only medicine that works immediately for lupus nephritis. We almost always have to use an immunosuppressant if it's that class 3, 4, or 5 that we see on the biopsy, as I mentioned earlier. So medications such as mycophenolate or cyclophosphamide and others. And then anti-malarial medicines are essential. They can actually increase remission rates in our patients. The most common one that we prescribe is Plaquenil, also called hydroxychloroquine. But there are other things that you can do and that you should absolutely do to help us out with your systemic lupus. Number one is to eat right for your kidneys. And with eating right, it's essential that you work with your nephrologist. They're really the experts when it comes to this. Oftentimes you need to regulate how much sodium you take in, how much fluids, and how much protein. Most people with bad kidney disease need to limit the amount of protein. So you want to have smaller portions of meats, and especially healthier meats such as chicken and fish. And then a plant-based diet that has lots of vegetables and fruits can especially be helpful. And if you're not sure how to incorporate a good diet in your regimen, just ask your doctor for a referral to a dietitian or a nutritionist. Exercise is absolutely important. Remember, if you exercise regularly, it'll help get more blood flowing to the kidneys and the brain and the heart and the lungs, and this can help decrease those cardiovascular events that I mentioned earlier. So doing regular low impact aerobic exercise, but also strengthening exercises, stretching exercises, and even mind body connection types of exercise such as yoga and Pilates as well. And then one thing that's not mentioned on here that is essential is sunscreen. Every lupus patient needs to wear sunscreen religiously all the time. And the reason for that is that when ultraviolet light contacts the skin, I'm sitting here in my office and my light up there, it has UV light coming out. It has ultraviolet light and it contacts my skin. It damages the cells underneath the skin. And guess what those cells release? They release their nuclear proteins. And then that anti-nuclear antibody or that anti-double-stranded DNA antibody can see the proteins from my own damaged cells. It makes these immune complexes that can then float to the kidneys and make your kidney disease worse. So sunscreen is absolutely essential. And then be your own best advocate. This is another lupus nephritis patient here, and this is his helper or his advocate, his social structure standing right next to him. But there can be a lot of strength in community, and there are a lot of community organizations out there that can be helpful. One is the Lupus Foundation New England, who's sponsoring today's talk, along with Aurinia, the pharmaceutical company, who's also sponsoring it. Thank you so much, because these two organizations have some really good resources for you. And Aurinia has a really nice lupus nephritis organization, and it's called All In for Lupus Nephritis, and I'll talk about it in just a minute. So in summary, and we're at the end, so the 30 minutes is up. Number one is understand your risk. Even though you might have systemic lupus, you might be in remission and doing amazing. Unfortunately, lupus nephritis will hit 50% of our patients, and you'll feel perfectly normal in the early stages. So we want to get that cup of urine on a regular basis. And I ask my patients to come in every 3 months to do that, because if we find it early, we can treat it quickly and increase your chances of going into remission. And then discuss your options with your physician. The treatments for lupus nephritis, they're getting more and more better all the time, which is just phenomenal. And the future is even brighter for better treatments for lupus nephritis. We're going to have more and more options. And so when your doctor talks to you about the treatment of lupus nephritis, ask them what all options you have and what are the pros and cons of those different options, so that you can make the best decision in conjunction with your doctor as far as your treatment. And then, of course, continue to learn. Just by watching this, you're learning about lupus nephritis, but also consider joining those organizations that I mentioned. Also, the organization called All In for Lupus Nephritis. And you can join it through a couple of different ways. If you're on Facebook, just go to the search engine on the Facebook page and type in All In, and you'll easily find it. Also, if you type in lupus nephritis, you can find it. But All In for Lupus Nephritis, it'll make it even easier as well. So it's a Facebook group that you can join to learn more. In addition, you could go to the website itself, which is listed right here on the slide. And when you go there, make sure that you get their lupus nephritis awareness kit. If you go to the website, and you can find the awareness kit very easily, and then you can sign up for it with your email and such, and you can get some very important and helpful information. So during the last 30 minutes, I hope that I've been able to share with you the importance of why it's so important we identify lupus nephritis so early. And if you do as I recommend, if you see us regularly and give us that urine sample on a regular basis, then we have a much better chance of catching lupus nephritis quickly, treating it as fast as possible, and hopefully getting you into remission. And thank you so much for watching this slideshow and this program, because the more you educate yourself about lupus, the better you can conquer lupus. Thank you very much.
Well, thank you so much, Dr. Thomas, for such an incredible presentation. I learned so much that I was not aware of, even though I've had lupus now for 20 years. For anyone that is here, Dr. Thomas is here with us, so you can ask questions below in the comments. If something popped into your head while he was giving that presentation, feel free to put it below in the comments. But before we sign off, I just want to ask Dr. Thomas, I have two questions for you. One, so we talked a lot about what the patient can do, but I wanted to know, what are some tips that you would give friends or family members that to help them support someone that gets a lupus nephritis diagnosis?
Well, that's a great question, Marissa. Number one is just always be there. Don't feel like you have to have the right answer for anything. If your loved one is not feeling good and they're voicing that to you, don't feel like you have to be able to give them recommendations or suggestions on how to get better. Just be there to listen to them. That's the best thing you can do. And also to have hope. Always give them hope for the future. Let them know that there's things that you're there for them, and that they're going to do better with their lupus, and that there is optimism for the future. That's one of the best things. Also, ask them if you can go with them on their doctor visits. I always encourage my patients to have a friend or family member at their doctor visits, because number one, it's hard to remember everything that the doctor tells you, and it's good to have a second set of ears. And also, it's just so you can understand what's going on with your loved one. Lupus is an invisible disease. Like, look at Marissa. She's this beautiful young lady, looks perfectly normal, yet she has this horrible disease going on inside of her. Someone can have horrible lupus and look completely normal, but if you hear from the doctor what's going on, that can make it a lot more alive for you and vivid, and you know exactly what's happening to your loved one. So those are just some of my recommendations.
Those are perfect. Thank you so much. And I wanted to ask you before we sign off, tell us a little bit more about what someone can find in your Lupus Encyclopedia book, and about lupusencyclopedia.com.
Sure. Lupusencyclopedia.com is a blog I just started. I want to put on very relevant, practical information that patients can learn to take care of their lupus themselves, but also be able to comment themselves and ask questions also. So lupusencyclopedia.com. I wrote my book because there's so many things lupus patients can do to help themselves out. And it puts it in layman's terms, non-medical terms, but also gives the medical terminology so that you can look up what your doctor actually said, but then read about what it actually means in layman's terms. But there's a lot of tricks and tips to living a long life with lupus. And I'll tell you, most of our patients today are in remission or low disease activity. Most of our patients are now living a long, normal lifespan. And if you can learn what those tips and tricks are, you can guarantee that you can hopefully be in one of those people who live a long, normal lifespan as well.
Wonderful. Thank you so much for that. We are so grateful to you for being here today. It was an amazing presentation, had so much information. We want to thank our sponsor again, Aurinia, for sponsoring this amazing episode of TILLY. So thank you so much. Feel free to ask questions below, and we hope that you join us for our next episode of TILLY. So Dr. Thomas, thank you again, and we hope all of you have an amazing evening.